Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be the facilitator for today's session. Today we have with us Dr. Elliot Montgomery Sklar and Lucy Barylak. They're two of our favorite presenters, and they're going to be talking today about Alzheimer's, dementia, and the LGBTQ plus community. So before they get started, let me tell you a little bit about each one of them. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. And she would also like you to know that she was a caregiver for her mother for about 10 years. Dr. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and also virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Elliot and Lucy, welcome to the session today.
Thank you.
Thank you. So our program today is an interesting and an important one. We have a number of amazing resources to share as well that we curated specifically for our program today. And as always, we'll be sharing a copy of our presentation that will include links with access to all of the websites that we'll be discussing. We'll also be staying on an additional 30 minutes. I will today. Lucy will need to leave us just a few minutes ahead of the hour, but I will be staying on after the hour for an unrecorded 30-minute extension to our program that is completely anonymous and really just a forum for your questions and discussions. So during our series, we have talked about how LGBT plus caregivers can often feel more isolation, even though we're caregivers at a higher rate than our non-LGBT peers, meaning that more of us are actually caregivers, and yet we might feel alone or isolated in that role. Now, there's new research that shows a higher rate of Alzheimer's and other dementias among LGBT adults. And when looking further, this research links with other health conditions and health disparities, which may be a factor in this increased prevalence among our community members. So today we're really going to take a look at all of this and a critical look at that. It's important to note that we don't really understand exactly what causes Alzheimer's and dementia. We're moving closer to having more answers. So we're not suggesting that there is some sort of a genetic or a biological link between being gay and, for example, developing Alzheimer's. Rather, there are some overall health and social issues that might be a factor in explaining this relationship. And we are still without many treatment options or a cure for Alzheimer's disease because we still don't know quite why it happens. So that means for elders in the LGBT community right now, we might need more care and have less people to provide it, as we've discussed during our series this month. And that means we need more social support, more overall support, more awareness of this issue as people are getting older and living longer. So before we dive in, I was curious just to open it up and see if there's anything that anyone wanted to ask or any questions or comments that anyone wanted to share.
You can just unmute your microphone if you would like to join in the conversation, or you can put something in the chat box.
Okay. Thank
All
you,
right.
Elliot, for that. Yes. You know, it's interesting that each year more than 16 million Americans provide more than 17 billion hours of unpaid care for older adults with Alzheimer's disease and related dementia. While all caregivers of people with dementia or other health challenges can benefit from support services and have common barriers, caregivers within the LGBT community have unique experience and unique needs. You know, Alzheimer's disease and dementia are neurodegenerative conditions that primarily affect cognitive function, memory, and behavior. They're often used interchangeable, but it's important to note that dementia is an umbrella term for a range of symptoms that include memory loss, cognitive decline, while Alzheimer's disease is the most common cause of dementia. Understanding the links between Alzheimer, dementia, and the LGBT community requires exploring several factors, including unique risk factors, social demographics of health, and healthcare disparities that affect this community. LGBT adults also face the additional burden of discrimination and social stigma, which can impact their access to medical care and social services. LGBT caregivers, whether it be close friends or family members of a person with dementia, may also be dealing with their own quality of life challenges. Health disparities are differences in health between different groups of people. LGBT people experience a number of health disparities. They are at a higher risk of certain conditions, have less access to health care, and have worse health outcomes. These disparities are seen in the areas of behavioral health, physical health, and access to care. So let's look at behavioral health. Includes mental health, substance abuse, and addiction. LGBT people are at a higher risk of suicide and suicide thoughts, mood disorders and anxiety, eating disorders, alcohol and substance abuse, tobacco use as well. If we look at the physical health, LGBT people are a greater risk for certain conditions, diseases, and infections. Older adults who are more likely to rate their health or poorer and report more chronic conditions while having less social support. You know, LGBT people are less likely to have a regular healthcare provider, access to care. People have less access to healthcare they need. They are less likely to have health insurance, more likely to delay getting care, especially in older LGBT adults, more likely to report poor health quality of care and unfair treatment by healthcare providers. So let's look at what causes these disparities. There are many causes of health disparities faced by LGBT people. These include the minority status of LGBT people, a lack of specific education and training for healthcare workers, a lack of clinical research on LGBT health-related issues, fear due to stigma, discrimination, and institutional biases in the healthcare system. So, having said all that, my question is, does any of this hit home for anyone? Have you experienced any of these situations that you would like to share with us today?
While people think about that, I'll share that during our program, our series, actually, our first one of this month, I shared a unique experience that I've had with my routine primary care physician that I thought was reflective of a certain kind of bias. I think also it's important for us to note that, that this information is based upon national data, but this isn't necessarily true for all people, all communities. But certainly that's what disparities mean, right? That things are not equal across the board. And that is certainly true. All right, well, having no comments while people think about things, we certainly invite you to enter comments in the chat box. We'll continue with our program. I wanted to talk about health risks of loneliness specific to the LGBT community. We know that there are health risks of loneliness. We certainly learned this during the pandemic. And research shows, in fact, that LGBTQ plus populations experience loneliness more often than other groups. Now, it's hard to measure social isolation and loneliness precisely, but there's some pretty strong evidence that many adults 50 and older are socially isolated or lonely in ways that put their health at risk. Some studies have found actually that social isolation was associated with about a 50% increased risk of dementia, and loneliness was associated with higher rates of depression and anxiety, and of course, suicide. That's why, certainly it's very important that we, think of interaction with others as a way of stimulating our mind, our thinking. And so loneliness certainly has health implications. I shared earlier that some of this new research is showing that there's a relationship between LGBT adults 45 and older and Alzheimer's and related dementia. And this research looks at a number of different factors, and we're actually going to give you the link to the article that cites all of this in the next slide. And we're going to look more closely at the data. In fact, it's a CDC study that was released last year that was suggesting this increased prevalence of Alzheimer's and related dementia. And it came from an examination of national data from the Behavioral Risk Factor Surveillance Survey. Now, I'm sure many of you don't know what that is because it's not something that people widely talk about, but it's actually public data that is collected every year. It's random. People are invited to participate. It's coordinated by the CDC. And this is actually publicly available data that is collected each year so that researchers from across the country can use it to draw connections between things and to see if one thing perhaps predicts another using different methods. So for example, I use this with some of my doctoral students. I had one student who looked at a relationship between marijuana use in California, where it is legal, and changes in body weight among adults there. Actually finding, surprisingly, that people who consumed marijuana weighed less than their peers who did not. Now, is that true across the board? We don't know. But what I'm trying to convey here is that we also don't know if these same relationships are true across the board with regard to Alzheimer's and related dementias and LGBT adults. And I say this because this data comes from people who self-report behaviors and their health conditions, which include their weight, their height. We know most people, for example, are not truthful when disclosing their body weight. And the main thing here is that this also includes self-reported cognition. Now, to me, that's the big limitation of this kind of research, because if you might have some form of dementia and you are self-reporting, are you going to be as precise or accurate? We don't know. Nevertheless, the highest risk factors came from an analysis of 2019 data, and it showed actually that high blood pressure was the greatest risk in terms of having a relationship with the development of Alzheimer's and related dementias. And the next highest risk factor was not meeting aerobic exercise recommendations. That was followed by obesity, diabetes, and depression. So what the data showed us is that more LGBT adults 45 and older reported these behaviors or these health conditions, as well as indicating cognitive decline of varying degree. So it's a very complex study, and there are a lot of limitations in my opinion. And we're going to look at the actual data because my question is really, are 3,200 LGBT respondents in 2019 representative of risk factors that exist across our community today? I'm not so sure. So that's why I'd like us all to be able to form our own opinion. And we're going to look at the data here. So I've also included a hyperlink to the actual study here if you want to look more closely at it. But if you look at the left of your screen and at the bottom, you'll see that this data was split between non-LGBT and LGBT adults. So by comparison, we have a very small sample of 3,200 people in comparison to about 87,000 for the rest of the population. And if you look at the risk factors, so first in row here is high blood pressure, or the first column rather. So if you scroll down to the bottom, you'll see that among non-LGBT adults, it was 50% of the population. And for LGBT adults, 49.2. So that's not a very big difference. Let's look to the next one where we're looking at aerobic physical activity. 48.5% of non-LGBT adults did not meet the criteria versus 53.9. So it's a little bit more of a difference, but not that substantial. When we look at obesity, it's 35% versus 33.7. So actually a lower obesity rate among LGBT adults in this sample, a slightly higher rate by 2% for diabetes. And the most significant one links to depression. 17.6% of non-LGBT adults indicated that they had depression versus 25.4% of LGBT adults. There could be many, many differences for why that is reported in that way. Some younger LGBT adults, and when I say younger in this sample, I mean in their 40s, receive mental health counseling and might be more open to sharing that information as opposed to their non-LGBT peers. We do know that this is true for men, for example. A lot of men are avoidant or non-disclosing in terms of their depression. So it's a very interesting and complex study, I think. And if we look more closely at the data, I'm not as convinced necessarily that there are these connections that that would otherwise be alarming, in my opinion. So I was curious if anyone else had any thoughts about this. Does any of this surprise you? Do you find it interesting? I know I'm a bit of a nerd. I teach health science, so data is interesting to me, but I think it's important to actually look at things more closely sometimes because you see that the differences might not be as dramatic as we think. So I want to hear from you all.
And I just put in the chat box, feel free to put your comments or questions there if you're not comfortable with speaking out. We understand that, but we'd love to hear from you and have you join in the conversation about this important topic.
I guess what you're saying, Elliot, is that, we have to really look at the studies very closely and make sure that the facts are what they are, because there are so many variables that come to play. And but that's true. However, there are very good points that you're making. We should look more closely at the research and at the risk more independently, what is really going on there. And many times it's not, we just take it for a fact that that's the fact, but it's so important. But there are other ways in our society in which Alzheimer's disease, dementia, and the LGBT community are interconnected. So for example.
Yes, but hang on, sorry, before you go there. I just wanted to finish up talking about some of the other research that exists aligned to this.
Oh, absolutely.
Because this is not the first time actually that a study did find this link. So I do, to echo what you said, Lucy, it is very important, I think, for us not just to look at headlines of findings, but to look a little bit more closely. But what is true, certainly, and this is for any minority population, is that chronic minority stress over the life course does heighten the risk of premature cognitive aging and also of cognitive decline. And that was also found to be true among LGBT adults in a 2020 study. In addition, another study that used the same national data set found, again, from 2021 data, so this was just a recently published study, that adults 45 plus were again more likely to report cognitive decline than their counterparts. But again, I think we need to look more closely at that data. What another interesting study found is that more frequently among transgender Medicare beneficiaries, Alzheimer's and dementia was reported more so than among cisgender Medicare beneficiaries. So there are definitely a lot of relationships and other health factors among adults in our community. I just think it's important, again, when we look at these numbers here on the left, there were over 87,000 non-LGBT respondents versus only 3,200, or 3.9% of that whole study sample. So is that really representative? I'm not so sure. And I apologize, Lucy. We can get back.
No.
Yes, Glenda, you had a question.
Yes.
I do. This is really interesting data to me, but I know one of the biggest risk factors with depression and other things that lead into mental health issues, and I know you're going to be talking about that next week, is isolation. And I know you touched on that on another slide. Do we have any statistics like this on isolation?
No, and the data is out there, Glenda. So that's a great idea that you've given me for a doctoral student.
Oh, good.
Because the behavioral risk factor surveillance survey does ask about how many people live in your household, what your interactions are like, how do you usually communicate with other people. It's a very rich database. There's a lot in there. So I think that that's definitely a great question and something that we should look at further. The other thing is there's some research that suggests that some of the medications that people take for depression might have a link with the development of Alzheimer's and related dementia, including benzodiazepines, tranquilizers. So that is something that we need to look at again more closely, because if there is a higher rate of depression, maybe it's not the depression itself that's causing the link here. Maybe it's the medication. So there's a lot more that we need to know. And one of those things is we don't even have a test yet for Alzheimer's. We don't know how to diagnose. So it makes for what I would consider to be a lot of limitations in the research. And there's been a lot of concern in our community about these findings. But when we dig deeper beyond just the headline that there is a higher risk here for our community members, I think that maybe that risk isn't as great as we think it is.
Thank you, Elliot.
Well, you brought up a very good point. I mean, the whole idea of loneliness and living alone. So maybe we could just explore that a little bit. So living alone can increase vulnerability to Alzheimer's and dementia in the LGBT community. As we said, you know, many people in that community live alone. So reduced cognitive stimulation, increases stress, and limited opportunities for social engagement are crucial for maintaining brain health. Delayed detection and diagnosis. You know, living alone may result in delayed detection and the diagnosis of cognitive decline. There may be no one close to the individual, leading to delayed understanding of the condition and subsequent intervention. So all these really sort of do make a difference. And in general, caregiving challenges, living alone can pose additional challenges when it comes to caregiving for individuals with Alzheimer's or dementia, necessitating reliance on formal care services that may be less inclusive or understanding of the LGBT identities. Now, LGBT individuals living alone with Alzheimer's or dementia may bear a higher burden due to the lack of support system. They may face difficulties in managing day-to-day activities. So what we're basically saying is that it's very important to look at the variables that do affect the LGBT community, especially seniors. You know, it's also, you know, coordinating medical care and navigating legal and financial matters without the assistance of a partner or a family member. So, we talk about depression, we talk about, well, if somebody is alone and doesn't have the support system that they need, many times it's inevitable that people can get very depressed. So we have to take all these things into consideration. And, I'm going to go again, see if anybody has any questions or comments, because I think we're really talking about very important things. And does anyone have any questions or anything you would like to share with us? Do we have any participants who live alone? If any of you live alone, or if you're a healthcare worker, do you have any clients that live alone and that you can see some things that you can do in helping them? How does the information, really make you feel? It's really, as Glenda, you said, you brought a very good point up. There's a lot to still deal with and look at, that's for sure.
Yeah. So Elliot, you have some comments there in the chat box. They're really interesting.
I did not see them. Thank you for pointing them out to me.
Certainly.
Andre said, far from me to want to underestimate the challenges faced by the LGBTQ elders, but it is almost reassuring to note that profiles are not significantly different, in a sense that the two groups are not that far apart in their health challenges. That being said, I suppose the issue of depression does not come as a surprise. It's a great comment, Andre. I appreciate everything that you shared there. And yes, that's why I shared it, because to me, it is actually almost reassuring to see that there are not such great differences, and that maybe the headline of the study suggests something that maybe isn't as significant. And Seth said, let's please be careful with language like it's inevitable people will be depressed. This is not so. And I appreciate that comment, Seth, certainly. And that's why, again, part of what we said is that this isn't necessarily true across the board. These are just findings based upon the experiences of us in running these programs for several years, but also of what research tells us. There is a higher percentage of older LGBT adults than their non-LGBT peers who do live alone. And it's important to, I think, explore these risks for living alone and how that might contribute to things like potential risks for Alzheimer's and dementia, and challenges also or delays to diagnosis. And with regards to depression, I understand, again, your point. I do feel like, so there is something called weathering, which is seen amongst African-American communities as an example. When you're constantly faced with prejudice or scrutiny, or you see headlines in news that showcase things that are not just, it weathers you. It takes a toll. Right now, our community is enduring a very challenging time. As the Human Rights Campaign said, that we are in a state of emergency for the first time in 4 decades. And so I think that some people might be feeling echoes of depression, or perhaps things that might be triggering. And Andre said, this is not what I meant. I am only recognizing the challenge, again, relating to be able to live your life as you hope, wish, and want. And certainly we echo that. I want to thank you all for your comments. And it contributes certainly to the meaning of our program, and also to understanding how we can best support all of your needs as participants as well.
So the question is, how do we help, and what do we do as individuals, as healthcare workers? So it's important, I think, community support, creating inclusive and supportive environments within the LGBT community that foster social connections, reduce isolation, and provide resources for individuals living alone. Education and awareness is so important. Increasing awareness among healthcare professionals, caregivers, and the broader community about the unique needs of LGBT individuals living with Alzheimer's and dementia. And these are the reasons why Elliot and I do all these sessions on LGBT months, because it's so important to educate ourselves. And as I'm listening to Elliot, I get educated myself, and doing the research that I do really tells me a lot about what still needs to be done. And caregiving support is so important to all caregivers, but offering tailored support services and resources for the LGBTQ caregivers, including legal, as I said before, and financial assistance, respite care options, and mental health support. Research, inclusion, supports equality, right? There was a study done at the Rice, which include a research registry for LGBT adults who have memory concerns or a memory loss diagnosis, or a care partner for someone with memory loss or a memory loss diagnosis. So you can look on that link. It's a very interesting research project and a lot of information. So by addressing the links between Alzheimer's, dementia, and the LGBT community, and the challenges faced by the individuals living alone, we can strive towards improved support, inclusion, and care for this population. So regardless of whatever is being done, it really isn't enough. And I think, as Elliot said, there's a lot of things going on, and we really need to be very aware of the consequences of the certain things that are being exposed and about the community.
And I think that really reinforces for our participants today, you might want to look at the RISE registry and what that is. It is a center for LGBTQ plus communities and individuals in Alzheimer's research, for community members as well. And what this is really is to build a resource for LGBT adults who either have memory concerns or a care partner for someone who does. And this is really a novel initiative. We've talked before in our series this month about the limitations to data that's being collected nationally as it relates to our community. And as such, we are challenged in the resources and in the specific supports that are allocated. For example, the census does not collect information about sexuality. So that is an issue because we then don't know what resources we might need. And that is, again, why we are here to discuss this issue, because if in fact there is some sort of a link between our community members and Alzheimer's and related dementia, then we need to have plans in place to better support our aging and to anticipate. So earlier this year, in fact, the National Institutes of Health announced that researchers have developed a blood test that could potentially detect Alzheimer's disease promoting compounds in the blood long before symptoms emerge. So it's one of the first stages of this type of diagnostic, and it's based upon proteins in the blood that are thought to be linked to the development of Alzheimer's. Now, the ability to detect these proteins would permit early disease diagnosis and allow for making strategies to intervene before, for example, cognitive decline occurs. We've talked in our programs before that are recorded about the role that lifestyle plays, like diet and exercise, in helping to improve cognition. So there are some things that we can do. Now we're getting close to having this kind of a diagnostic test become a reality. And I think that will be a game changer for people in terms of how they plan and prepare. But that might also be a very scary kind of a blood test to take and learn about. So it does, though, promote some hope that better treatments, most importantly for Alzheimer's and related dementias, may soon be on the way. I do see that we have some messages in the chat. Andre shared, for example, my work is closely linked to long-term care and the realities that some of our residents will hide their reality. For instance, a lady who is a widower is asked, her husband passed and will not correct the assumption when in fact she has lost her wife, which is a great example. We do make assumptions, and it's something that we need to not be doing. Seth said you bring up another good topic, Andre. A factor we are not hearing about is where each individual is in integrating their identity, including being out to carers and care facilities. And that's an excellent point, something that we did talk about in our first two programs in this series, because this is considered by some to be the first generation of out seniors that we are caring for, that we are facing these issues with. That's why these issues are so important for us to be discussing, because we learn from the experiences of others. Does anyone have any other comments or anything that they want to share with us? We had planned our time today to be very interactive, and really wanted to walk everyone through that data. We know that for now, it's really important for people to know that their local Alzheimer's Association chapters have LGBT focused support groups. And we prepared, as I said, and curated a very, very comprehensive list of resources here that are specific to Alzheimer's and dementia among LGBT caregivers, as well as supports for caregivers and for also finding long-term care. We did still include here the Human Rights Campaign's Long-Term Care Equality Index and their new digital guidebook, which includes new updates to health and safety laws, policies, and resources based upon state by state, as we know that this is evolving. And Seth said, thanks for these resources, looks very helpful. We're happy to share them. And anything that you see here that is in blue is hyperlinked for you. So when you get a copy of these handouts, you can just click on them. And I want to thank you all.
Wonderful. Boy, we're really early. Let me tell you a little bit about what's coming up on the Caregiver Teleconnection. Next week will be the last in this series, The Pride of Caring. And Lucy and Elliot will be back on Wednesday, June the 28th, and I'll be joining them, happily so, at 10 o'clock Central Time. And we're going to be talking about mental health among LGBTQ plus caregivers. And so that's a really important topic that I said to Elliot earlier, we need to talk more about, and mental health in general, we need to talk more about. Tomorrow, if you've been tuning in to Dr. Jamie Heisman's series on emotional intelligence, he's going to be doing a session at 1 o'clock tomorrow, continuing with that series. And the topic is caregiving through the lens of self-awareness. We all need to be more self-aware for sure. So that will be the end of the month of June on the Caregiver Teleconnection. And I just, I'm an older adult. I don't know where time is going, but it's flying by pretty darn fast. So does anyone else have a question or a comment related to the presentation today, the data you saw, your own experience in particular, that we can continue the discussion with? As Elliot said, he is going to continue on for a half an hour to have a conversation with you privately. It will not be recorded, and I will be leaving you at that time. Anyone have a question, comment?
I just want to ask you, Elliot, you were saying that it would be interesting to have a study from one of your graduate students. Could you just talk a little bit about that? Because that's sort of intriguing to me.
You're muted, Elliot. Elliot.
Sorry about that.
Oh,
I apologize.
My
My view changed and I couldn't find myself in the participant list.
there.
So many people don't recognize, but there is national data that is collected every year from a sample of Americans. It is collected in a bunch of different surveys. One of them is one that we shared today called the Behavioral Risk Factor Surveillance Survey. That is based upon self-report. It looks at health behaviors like diet and exercise and chronic health conditions. It does look at your social support network, but it's all based upon self-report. Sorry. So we know that there's some limitations to self-reported data. However, the Behavioral Risk Factor Surveillance Survey has been a study that has been conducted for over 40 years. It is seen as a very reputable study and database, and it is published by the CDC. Then there is another one called the National Health Examination and Nutrition Survey, which is another national data set. But that one is a little bit more precise in the sense that they actually have people that go out to your home that collect urine and blood specimens, that weigh you, that take your blood pressure. So it's not based upon self-report, it's more precise. But it doesn't look at some of the other more holistic things that we were talking about, like living alone, social support networks, and things like that. So these databases are used by researchers, not just graduate students, but by full-fledged Harvard-level researchers to look at connections between health issues in our overall population. And because the sample size for this study is so large, it makes it very reliable in terms of if you were doing a local study, for example, you could probably only enroll a local population and maybe a few hundred participants. Here you're looking at data in the thousands, which makes it more accurate. So what the study here found, as we saw, was that yes, there do seem to be some factors among LGBT adults 45 plus that link with risk factors for Alzheimer's and related dementias. But we might slice up that data differently and find other conclusions from that. So I think, Glenda, what you proposed in looking at social support, living alone, that would make for a very, very rich study, certainly, and could be done from this national data because it is free and publicly available.
Yeah, I think this is very, very important. So we don't label and we don't make assumptions, that there's really good research behind it. Obviously, when we talk about caregiving issues in general in our other series, loneliness plays a tremendous role in the whole idea of being depressed and even, developing mental health issues. Yeah.
Absolutely. And I've said before that I still believe in our society, we view caregiving as a gendered issue. We focus more on women's issues commonly, and we need to change that. And when you look at the LGBT community, when you have two female caregivers or two women living together who have the potential to care for one another, their journey may be very different than two men. And we lump everything in together and we talk about LGBT as one, but the issues may not in fact be the same, especially when it comes to caregiving.
Absolutely. Right.
And I have a particular interest in the living alone and loneliness information also, because I do live alone. Lucy, I know that you live alone also. And I find, I liked what Seth said, that it's not inevitable that you're going to get depressed, but I find it takes intentionality in order to stay engaged and to be active and to, see other people, whatever, do things that are going to keep you engaged. And I think that helps, definitely does for me. So that information is interesting to me. I also wanted to say to you that in a couple of days, you will receive this presentation in its entirety so that you will have the hyperlinks for all the resources. Elliot does the best resources of anybody I know, so please use them. They are always good ones. And Elliot, Andre, yes, he did. He gave us another link there that you might want to look at in the chat box also. So look for the follow-up survey that also comes with the email that you will receive if you register for this call. Please take the couple of minutes to fill it out. Let us know how we're doing. Let us know if you have other topics that you would like to be see presented on the Caregiver Teleconnection. We're always looking for topics and we're always looking for presenters. So we'd appreciate your help in that way. So I'm going to be leaving you. Lucy, I think that you're also going to be leaving us.
I'm going to be leaving you as well. Thank you, Glenda, so much. Elliot, thank you so much. And to all of your participants, thanks. And we'll see you hopefully next week. Bye-bye.
Next week. Okay, well, I'm going to
you.
stop the recording at this time and I will say bye-bye.
Thank you, Glenda.
Have a-
Appreciate it. Thank
There we
you.
go.